arterial supply, but I hope it was clear the difference between the superficial and deep system. Just moving back centrally to the heart, I'm now going to work my way downwards to look at the blood supply from the venous drainage from the lower limbs. So you've got, I've shown you the superior vena cava and the inferior vena cava leading into the right atrium. So I've removed a lot of vessels here. I mean, there are a lot of branches on the inferior vena cava which I've removed, and we'll talk about in future tutorials on the digestive system and the blood supply and drainage of those various organs. So just down here, we're now at the level of the L5 lumbar vertebra, and this is where the inferior vena cava bifurcates into its branches. So you've got the common iliac veins, so you've got the right and left common iliac veins. So these split into two. You've got the external and the internal iliac veins. So the external and the internal iliac veins join to form the common iliac vein, and that converges with its counterpart to form the inferior vena cava. So you've got the common iliac vein, which splits into the external and internal iliac vein. So just before I go any further, I just need to point out another important vein. So you can see running on the anterior surface of these vertebral bodies, you've got a vein running up and draining into the superior vena cava. So you can see it running up the anterior surface of the vertebral bodies and then draining into the superior vena cava here. So this is the azygos vein, and the azygos venous system drains blood from the posterior walls of the abdomen, of the thorax and abdomen, and it drains into the superior vena cava. So this is the azygos vein, and that runs on the right side, and you've got the accessory and hemiazygos veins which run up the right side, the left side, sorry, of the vertebra. So that's the azygos system, which runs on the anterior surface of the vertebral bodies and drains into the superior vena cava. And so you've got the accessory, the azygos vein on the right side, and you've got the hemiazygos and accessory azygos veins running up the left side. So just moving back to where we were, we've got the common iliac veins, which are formed from the external and internal iliac veins merging. Working our way down, the external iliacs are formed from the femoral vein, and this long vein which runs down the entire length of the leg on the medial aspect, and this is called the long saphenous vein. So it runs all the way down the medial aspect of the leg to join the dorsal venous plexus of the foot. So just going back up again. You've got the external iliac being formed from the femoral vein and the long saphenous vein. So the long saphenous vein is a superficial vein. The femoral vein is a deep vein. So if I just put in the muscle layer, you can see this. So you can see the femoral vein just runs deep into the muscle layer, and then the long saphenous vein runs superficially all the way down the inner leg. So it's medial, it runs medially all the way down to the foot where it joins the dorsal venous arch of the foot. So that's the long saphenous vein. So the long saphenous vein and the femoral vein drain into the external iliac vein. Just working our way down to the back of the knee now. So we're now in the popliteal fossa region. So that's the back of the knee, is called the popliteal fossa. So the vessels at the back of the knee are popliteal vessels. So you've got the popliteal artery here, and you've got the popliteal vein here, which drains into the femoral vein. So this is the popliteal vein, and you can see the long saphenous vein here running all the way down the medial side. So the popliteal vein has a branch, the anterior tibial vein, which goes here down the anterior aspect of the tibia, just like the anterior tibial artery. And then you've got these two veins. You've got the peroneal vein, which is also known as the fibular vein, because it runs on the fibular side. So the peroneal muscle group, or the lateral muscle group of the lower leg. So this vein, which comes off the popliteal vein, is the peroneal vein, and this runs on the lateral side. So it's the fibula, also known as the fibular vein, so it runs on the side of the fibula, which is lateral. And you've also got the posterior tibial, so the counterpart to the anterior tibial vein, and this runs down the posterior aspect of the tibia. And then you've got another superficial vein, so this is the short saphenous vein. So remember the long saphenous vein, which runs all the way up the medial aspect of the leg. The short saphenous vein runs centrally down the back of the leg, and it's superficial. So it's quite hard to understand, to judge the depth. So the deep veins are these posterior tibial veins and the peroneal veins, and the superficial veins are the saphenous veins. So the long saphenous, which runs all the way down the medial aspect, and the short saphenous, which comes off the popliteal vein here. So the short saphenous vein runs down the back of the calf muscle, and then it winds round laterally and joins to form the dorsal venous arch of the foot. So this arch here. So remember the long saphenous vein, which ran down the medial side, joined to form the venous arch. The other side of the venous arch is formed by the short saphenous vein, which runs down the middle of the calf and then winds round laterally. So in the lower leg, you've got superficial and deep veins. So a deep vein thrombosis occurs in the deep veins of the legs, and a deep vein thrombosis can occur all the way up into the femoral vein, which is also a deep vein. So this vein, this thick vein here. An important thing to be aware of that isn't actually shown in these models is that you have veins which connect the deep and superficial veins. So perforator veins which connect the deep to the superficial veins. And blood flows from superficial to deep. So if valves become incompetent in the veins of the leg, blood may then accumulate in the superficial veins, so in the long and short saphenous veins, which then become swollen and tortuous, so you get varicose veins. So that's what varicose veins are. So those are the important veins of the body that you should be aware of.